Next, we'll call up Bridget McCoy, if you're still here, from Families and Children Together.
Good morning, everyone. My name is Bridget McCoy, and I'm the CEO of Families and Children Together, known as FACT, located in Flint, Michigan, serving Genesee and Saginaw counties. Pleased to be able to testify today in support of a $2 million line item in the budget for FACT that will enable many families in mid-Michigan to remain together safely rather than be separated through foster care. For those families whose children must be placed in foster care, this line item will support organizing all of the work around enhancing parents' protective capacities and the community support of those capacities. The success of this approach to supporting whole families will also be adaptable for statewide use and provide a national example of community-based support for families. Right now, it takes approximately 2.5 years for children to reunite with their families. At FACT, we believe that we can help children in foster care reunite with their families much sooner by getting the rights services in their own communities. We operate on the principle that families know best to help them stay healthy, strong, and together, and in doing so, will make their communities stronger and safer. Nationally, 2/3 of children in foster care are there due to what's been deemed to be neglect, not abuse of any kind. Their placement in foster care is almost always linked to poverty in some way. Because there are limited pathways to get help to families, a child abuse hotline is called rather than seeking out community organization for resources. Therefore, we often deal with poverty in the same ways that we deal with physical or sexual abuse by calling that same child abuse hotline. They are not the same, and we should not treat them the same. We should reserve our most intensive interventions for those situations in which children are experiencing actual abuse or harm. We currently have a vibrant network of agencies, providers, and services in Genesee and Saginaw counties. We are working actively to coordinate and unite those resources into an organized network so that families know where to go for help before a need becomes a crisis and a crisis becomes a catastrophe. The $2 million line item will support the further development and operation of this coordinated effort, which is modeled after successful community-based support efforts in other states. It will allow us to provide liaisons to schools and medical facilities to advocate for children, provide essential life skills for families, provide supports to meet basic needs such as food, clothing, and shelter, the absence of which can tear apart families or keep them apart. Support frontline staff, providers, and collateral stakeholders to approach families in engaging, family-driven, proactive ways that promote relational health, connection, and belonging. Provide shareable data across the FACT network through implementation of technology, and create community-based hubs in higher risk neighborhoods where key supports, services, and providers are accessible in one place for families before a potential child abuse hotline call is made. Creating a network of community-based supports will benefit not just our families involved in foster care, but a much broader segment of Michigan's population who live on the edge and without essential supports may become involved in foster care. We see this as having a positive impact on the state's mental health, juvenile justice, and corrections program by reducing the trauma to children that often leads them into those systems associated with child welfare. FACT is not one...
I'm sorry, Bridget, can you wrap it up?
Yep. FACT is not one agency. It's a network of caring supporters, community supporters from all sectors that might impact families who live in the communities. It's an approach, not a program. And it's a way to demonstrate that we believe in families, that we are committed to including and supporting them, and that they will always be heard, seen, and respected in our hubs, agencies, waiting rooms, offices, and the streets of the communities where they live. Happy to entertain any questions, and I'm so sorry I did not introduce Robert Cram, who is helping to support our operations and project management.
Any questions from the committee? Thank you for your testimony today.
Thank you very much.